Well, new research this morning finds more evidence connecting hits to the head to the onset of CTE, a neurodegenerative disease common in football players and athletes. So the study was done by Boston University researchers analyzing the brains of teenagers with head injuries. Now, researchers in the study said that while it's a big problem with professional athletes, it is a bigger concern for younger athletes as well. And joining us to talk more about this, Dr. Elizabeth Mead with Swedish Medical Center. Thanks again for joining us. That's what I find interesting about this study, is that this talked about teenagers, because we talk about professional athletes all the time. What does this study say about teenagers and getting CTE?
Well, one of the concerning things about this study is that they're showing that some of these changes can start even in adolescence. So when they looked at brains of teenagers who had died after multiple head injuries, that they already saw some of these changes that are concurrent with sort of long-term CTE.
Wow.
Yeah.
You know, I'm a parent of young kids, and that question is going to come up in the next couple of years. You know, possibly am I going to play football, soccer? But I mean, what do we talk to our kids about? I mean, what should we say about that when that comes up?
Increasingly, I think pediatricians and family doctors and parents are getting really concerned about kids who are playing contact sports like that. How early are they starting? How many repetitive hits are they getting? And I think that's really one of the things that this study adds as well, is that it's not just concussions that lead to CTE, it's actually non-concussive hits also.
Yeah. The study pointed to the fact that head trauma, not necessarily concussions, lead to CTE. What do parents and schools need to be looking out for?
So I think one question to ask is how do schools handle practices?
Right.
So our practice is non-contact. That helps a lot in diminishing that overall sort of accumulation of brain injury. And also, what do they do if a child gets a head injury during a game or a concussion? How do they handle that, and what are the steps that they take?
Are you noticing when you go to, when you see young patients or parents, when you talk to them, are you noticing people or parents saying, you know what, my kids are just not going to play football anymore? It's not even football either. It's like it's soccer too, because
it's soccer, it's hockey,
too.
it's lots of sports where there's head contact. So a lot of parents are really saying that. They're saying, I don't want my kid to be at risk for this. We don't really know how early it starts, how quickly it can develop yet. So lots of parents are looking for team sports where there's not so much contact and wanting to enroll their kids in those instead.
And then will kids show specific symptoms if there's an issue after a hit to the head that isn't a concussion? You know, if it does happen, what should parents be looking for at that point?
That, I think, is the scary part, because if a child doesn't have a concussion, they may seem completely fine and normal after a head injury, and they may be completely fine and normal. But what we know now is that years to decades later, those repetitive hits could lead to CTE, even if the child has never had a concussion.
And then how can the family doctor get into this conversation? I would imagine that would be key in something like this.
Yeah, I think having your family doctor or your pediatrician talk to the child about what the risks are and what the benefits are, and also how to handle head injuries. I think kids are really apt to sort of just brush it off, say, I'm fine, I want to go back to playing, and they need to take this seriously. And so I think encouraging kids and teens to be honest when they get an injury about exactly how they're feeling and what symptoms they're having.
Is the equipment that you're noticing, though, getting better, though? Because we've done stories where you see, like, football helmets kind of revolutionizing into something a little bit better. I've seen a lot of soccer players kind of wear, like, this, I don't know, this soft kind of helmet in there. I mean, do you notice something like that?
You know, we've made a lot of strides when it comes to personal protective equipment, but I think the real concerning thing is that even in NFL players who have access to the best of the best, we're still seeing CTE develop. And so I just don't know that we have a good way to completely prevent it right now.
But bottom line, just have the conversation.
Have the conversation. Really think about your kids. You know, if they're playing baseball in one season and football in another season, that's a lot of hits. So we really need to be thoughtful about how many hits we're getting over a lifetime.
All right, Dr. Elizabeth Mead, thanks again for joining us and talking about this very important discussion. Appreciate it.